Good evening. Welcome to all physicians Riverside County Public Health Officers meeting. I'm privileged to introduce to you our new Riverside County Health Officer, Department of Public Health, Dr. Jeffrey Leung. Dr. Leung has had illustrious career at a very young age. He completed his medical degree at Baylor College of Medicine, then residency in family medicine at Kaiser Orange County, and his Master's of Education at Harvard. Dr. Leung has been family physician in Riverside County since 2006. He has served mostly rural areas. He has served as the Riverside University Health System as ambulatory medical director and supports teams at 13 RUHS community health center sites and medical center clinics. At RUHS Medical Center, Dr. Leung served as the chair of family medicine and chief of staff as well. More recently, Dr. Leung worked closely with RUHS Public Health in supporting COVID efforts across Riverside County and leading the county's incident management team for the Riverside County vaccine rollout since December of 2020. Dr. Leung loves the Riverside County. He's a big supporter of community health and health education. He's also an accomplished swimmer, loves music, enjoys traveling, is very passionate about national parks. Recently has traveled had a trip to Big Sur. He lives with his wife Teresa, a teacher, and two kids, 9 and 11. Dr. Leung.
Thank you, Dr. Singhvi, for the very generous and kind introduction. I apologize for the background noise. I'm in between sites and a little bit behind schedule. So thank you, for allowing me to join the meeting this evening, and looking forward to having a chance to do these calls. I just had a couple updates maybe before we jump into the questions. We know that people have been following the news regarding Johnson & Johnson, and probably many of you already have heard that the CDC's Advisory Committee on Immunization Practices, they met yesterday, and they decided that they would wait another 7 to 8 days data. So Johnson & Johnson continues to be paused, likely through the end of next week, and we'll be we'll be waiting for further word from them. The CDC actually had a very nuanced message, and they also said that, theoretically, if a provider feels like the advantages of Johnson & Johnson outweigh the potential downside, that they could still consider using it. However, in the state of California, California Department of Public Health has asked us to all pause. So just in case that messaging is a little bit confusing, that would apply to people outside of providers outside of California. And then just a couple other updates. We've been getting some feedback recently through some of our different groups at the vaccine incident management team. There may be some confusion regarding vaccination of individuals who previously had COVID. So we just want to remind people that although when the CDC first came out with the recommendations on COVID vaccination for those who've been previously infected, and said that you could wait, up to wait 90 days before administering the vaccine, that was during a time when the vaccine was very scarce. And so we are recommending that everybody who's been infected also get vaccinated, and really you can do that on day 11, as long as your acute symptoms have resolved or are dramatically improving. And so I'm happy to jump into the questions, and we'll follow your lead, Dr. Singhvi and Dolores.
First question regarding patients who received COVID vaccines and are due for other shots like Boxero, Menactra, etc. Is there an interval between doses of COVID and non-COVID vaccines or contraindications?
Yeah, so that's a great question. So first of all, the official recommendation from the CDC is that we wait 14 days in between the COVID vaccination and other vaccinations like this. However, if if we feel that that patients need either other vaccines in a shorter window, we do have the option to do that. So, you know, ideally 14 days, but if you're in a situation where someone is traveling, you don't think someone's going to be able to make it back to clinic, you think, you know, a vaccine is critical in terms of a time window, you do have the option to give the vaccine.
Next question. Schools are now open and we are getting children sick with upper respiratory infections. Schools are asking for clearances to go back on the campus and for COVID PCR tests. What are the guidelines if children have upper respiratory infection? I gave a parent option of 10 days quarantine or get any COVID nasal test, and if negative, I would clear them for in-person school. What would be your approach?
So, you know, I actually think this is a great approach, and I think this is a very, timely question, because we'll probably be encountering this situation often. So, you know, our recommendation is to continue using your best clinical judgment, and those two options of both the quarantine as well as a test with the option to then clear someone and return them back to school, we think is very appropriate. Now, you know, if someone is still symptomatic, you know, we would try to treat that appropriately as well. For instance, if you think someone has a URI, but they are too symptomatic to return to school, obviously take that into consideration as well.
Next question is, if a patient has a case of loss of taste and smell in an 18-year-old 1 month after a rapid test, nasal COVID negative, serum SARS-CoV antibody IgG positive, all 1 month into symptoms, and nasal COVID PCR negative recently, are symptoms still from COVID?
Yeah, so you know, given the positive IgG, it sounds this probably is someone who recently was infected, but may not currently have an active infection and may have some, you know, residual symptoms.
How effective are the vaccines? Please comment on all three against the various variant of COVID strains.
So I think the short story is we are still trying to figure out how effective the vaccines are against the variant COVID. You know, have very little data on the strains that are in California. Data. Look at the Johnson & Johnson data. You know, we know that in the South Africa area, the efficacy was lower than in the U.S. And then also, if you look at sort of the most recent studies looking at, you know, how effective the COVID vaccine has been after the second dose for mRNA, suggesting that it looks like it's about 90% effective, which is a little bit lower than what it looked like in the phase 3 trials. You know, part of the hypothesis is that maybe some of that reduced efficacy is related to the increasing variants since that phase 3 trials.
What variant COVID strains are most prevalent here in the Inland Empire?
So the variant strains that are most common in the Inland Empire area are the UK strain, but in California, the strains that are most common are the West Coast variant strains. And so far, you know, we have not seen any of the Brazilian in Riverside County.
So which one you'll fear most?
Well, you know, the West Coast strain, although it does not look as virulent, it probably is 20% more transmissible. And, you know, that is where we're seeing probably the greatest load in California. So that's probably the one that we're watching very closely, along with the B117.
What are the implications for the Riverside County with the hold on the J&J vaccine? And what is our current vaccine success rate? And when do you think we will reach herd immunity?
So, you know, in terms of the J&J vaccine, because we did pause starting on Tuesday, April 13th, Short term, that means that anybody who was scheduled for a J&J vaccine appointment, has either been flipped to an alternate vaccine or has been offered to reschedule. But overall, our vaccine supply is still good. So as long as people are open to the alternates, we believe we can continue at a good vaccination rate. In terms of success rate, we have about 1.3 million doses administered right now in Riverside County, and about 39% of our population has received at least one dose. It's partially or fully vaccinated. And we think that at this current rate, we would probably be reaching herd immunity, 75% or so by the fall. However, if we can increase our rate and fully utilize the capacity of our clinics and pharmacies and sort of the infrastructure that's been developed for vaccination, including the mass vaccination sites, we think we could get there much sooner, maybe even June or end of June.
There is no issue with the supplies. Are we getting enough supplies, and how to communicate with the population? That's another issue, because a lot of my patients don't know that it's available freely.
Right. So we think we've got a communication challenge. We need to make sure that we get the word out, that people know that they can, anybody 16 and up in Riverside County who works, lives, or goes to school in Riverside County can get vaccinated at no cost. And there are appointments available at mass vaccination sites and pharmacies literally today and tomorrow. So we want to encourage, everybody to take advantage of that. The challenge is if we do not use up the vaccine that we have quickly, other counties will be requesting it that are using it at a faster rate.
Are we starting to experience a fourth surge like the East Coast?
It is true that if you've been watching the case rate and the positivity rate, both of which have been falling, very recently they've leveled off and they're actually starting to go up gently. And we do expect that with reopening. Our hope, and this is where it really is a race, is that if we can stay ahead in terms of vaccination and precautionary measures, our goal is to keep the rate of cases and transmission low enough so that we're not then sort of overwhelming hospitals or emergency rooms or increasing our risk for additional variants. We would not call it a surge, but we would say that we're starting to experience a rise, a gentle rise in the positivity and case rate that is likely related to the reopening.
Okay, Dr. Singhvi, there are some questions in the chat. Shall I go ahead and
Yeah,
read
please
them?
go ahead. That
Okay.
will help us.
Okay, so Dr. Leung, back to a previous question. Is the rationale for a 14-day wait so that we can monitor side effects isolated to the focus vaccination?
I think that's part of it, as well as probably more theoretical ideas of, response to the vaccine. I think a lot of it is based on an abundance of sort of caution. And it's likely that if we have more information in the future, we may have more comfort with giving vaccines either concurrently or in a smaller window.
Okay. The next question, how long is immunity thought to last after COVID infection? Can those who have been infected count towards herd immunity?
Yeah, so that's a great question. We are really trying to look at, vaccinated individuals as our gold standard for herd immunity. But it is true that we know that for at least 3 months, people probably after an infection, they probably have pretty good immunity. And there's a good chance that they have some immunity, beyond 6 months. We don't have a good sense of, how strong that immunity is beyond that. And we do know that when you compare the antibody response during a natural infection versus an artificial immunity from a vaccine, that the response that you get from the vaccine is much greater. So again, even if someone has been infected, we strongly recommend that they get vaccinated. you know, that you've also heard of cases of reinfection when people haven't been vaccinated.
Thank you. Okay, the next question, it has two parts to it. So on the different tiers, do Boy Scout and Girl Scout activities qualify as private events or as simple gatherings? If we have a Scouts only defined guest list, does that qualify as a private event? And
So, yeah, so that's a great question. And for anybody who is trying to maneuver or navigate the blueprint for activities, you know, you will sort of experience this in many areas where you see activities that may fall into one category or another. And I think the Scouts is a great example. You know, definitely if you have a defined guest list, if you're thinking about an event where, you know, you've got maybe pre-assigned seating, that can qualify as a private event. But if you do not have that guest list, if it's more informal, then you would probably fit under the informal gatherings or the regular gatherings guidance.
And the second part of that question, since those under 16 cannot yet be vaccinated, we do not meet the requirements to show that all are vaccinated. It would be nearly impossible to have people tested prior to each weekly Scout meeting. How do we handle that?
Right, so that is challenging. It's in that sense, it may be easier to think about spacing and using the capacity limits rather than using these testing and verification of vaccination as a strategy for sort of thinking about how many people you can have within a space.
Okay, thank you. We have any information on the new Indian strain?
I don't have any additional information at this time, but we'll be watching it closely. And certainly we haven't identified any of those cases in our county yet.
Okay. What will be the metrics from public health to completely reopen and no longer need masks?
So, you know, our county, like other counties in California, will be following the California Department of Public Health and the state guidelines. So they have been fairly proactive. And, you know, the governor has already signaled that starting June 15th, his hope is that, you know, we can return to a somewhat normal activity. But many people suspect that we'll likely be using masks through the end of the calendar year, unless we hear otherwise.
The next one, I am happy that all the measures we took in past months are showing results now with an all-time low COVID cases. Everyone is glad to see schools reopening. I have heard many concerns about discrepancy in elementary school schedule with middle and high schools. With the new schedule, many parents have to drop off kids at elementary and then wait for 1 hour till middle and high school allows entry. Parents also need to report to work. What county health leader guidance to overcome this discrepancy or allow parents to have excuse from work or allow delays start? Parents feel that all school levels should move to the next tier, 5 days a week, regular schedule together. So a statement and a question.
Yeah, so as a parent of two children, you know, I'm very sympathetic to this, and we realize that the way schools run can have a very significant impact on the rest of society. So kind of going backwards with the question, you know, first of all, because we are now in the orange tier, all schools are allowed to open 5 days a week, full time. And so, you know, districts are deciding when they want to do that, how they want to do that, if they want to do that. But that's certainly not up to the county. You know, we've already qualified for that. Schools do have to, are supposed to make a safety plan transparent, and they really should be posting that. And then in terms of the schedules of elementary school sort of competing with middle and high school, you know, it's really more of an operational challenge for the school districts. And at this point, there's not so much a health-related reason that it needs to be one way or another. But we do also try to talk regularly with the schools. We have weekly school meetings, and we also meet with the school superintendents. And really our goal working with them is to help support them with reasonable common sense solutions. So we don't want people to get too caught up in all of the detail of the guidance and sort of miss the forest for the trees. So our hope is to be able to support that so people can get back to normal life.
Thank you. And one last question. Vaccine hesitancy education in the county is in certain geographic areas can be a focus for flare-ups of COVID-19. Are there specific programs in Riverside County Public Health one can access and direct groups to?
So this is a great question. So this is our next biggest challenge. Initially we didn't have enough vaccine, then we had to build capacity, and now that first third of the population who is eager to get vaccinated has gotten vaccinated. And so now we're kind of in that middle tier of individuals who may be on the fence or who may be open to getting vaccinated if it's convenient, or who are just waiting a little bit. There are some resources that we know the state is putting together. We're currently trying to put together some resources as well. We've been working with community benefit organizations who have been trying to work with populations in culturally sensitive ways. But we will be happy to share tools as they're developed. We've been doing a lot of brainstorming and work on this right now. So I wish we had something that we could share this evening, but we are working on it. And as we identify tools, and if people know of other great resources, please feel free to share, but we'll certainly be happy to forward that or bring that back to RCMA.
Thank you. Okay, Dr. Singhvi, I will turn it back to you. That concludes all the questions for tonight.
Thank you, Dr. Leung, and thank you all the attendees.